Okay, anyway, very good afternoon. And it gives me immense pleasure to introduce one of our junior speaker, Dr. Pragathi Poojary. So I would like to say a few words and then Dr. Pragathi will take over. See, today she'll be sharing a few cases, few successful cases from her practice. Dr. Pragathi started her clinic, if I'm right, recently she celebrated her first anniversary of her clinic. So it's been a year since she started. And see, this shows, you are into practice, you are into business for a year, and you are ready to present cases. It shows how committed she is. And I feel very proud to introduce her to all of you here today, because as Dr. Manohar was rightly trying to tell, that we need the second line, okay? And Dr. Harsha, Dr. Swati, Dr. Kiran, Dr. Guru, and of course we have Dr. Pragathi Poojary today. See, one thing what I liked about Dr. Pragathi is, she's been my student, now she is my colleague. It's a nice feeling, but what I want to try to tell you is, she's a girl who had planned her career very beautifully. She finished her BHMS from Government College, and immediately she went to Mumbai, did her SCPH in Mumbai, and parallelly she was working with Dr. Nishant Gandhi. Immediately she came back to Bangalore, and she didn't waste a single day. She started a practice. And I'm very happy and very proud to tell that, practice is beautiful. And I get to hear from Dr. Shweta about Dr. Pragati's success. And personally, I feel very proud and very happy. And see, she's a girl who will be inspiring many of the youngsters, because very few of us have seen this kind of a success in a very short period, including me, Dr. Manohar, Dr. Devraj, whoever we are talking of. Within a year span, seeing a success is a big thing, and that shows our commitment, that shows our passion. A very warm welcome, Dr. Pragati, from all of us, and we are very eager to listen to you. Okay. And also one more very important thing I would like to share is, see, all the cases she had mailed it to me. Cases are little lengthy. Please have patience and try understanding and try interacting, so that you get a better understanding of how she takes the case, how she converts that into rubrics, and the results are beautiful. The remedies that she's taken are shocking remedies which you'll never think of. I'll not reveal much. And as Dr. Harsha rightly said the other day, he was the youngest to speak on this platform. Swati broke the record, and it is Pragati's turn. Now probably she is the youngest speaker as of date that she'll be speaking on this beautiful platform. All the very best, and please carry on with your presentation.
Thank you so much, sir. Good afternoon, everyone. I will start with paying my tribute to Dr. Samuel Menon, because of whom we all are gathered here. Our Guru, Dr. Praful Vijayakar, my sincere respect to him. My mentor and guide, Dr. Nishant Gandhi and Dr. Zulari Gandhi, for teaching and sharing the knowledge unconditionally. Thank you, Vijay Krishna sir, for his ever enthusiastic and inspiring teacher, who helped me to reach this stage. Thank you very much, sir. So let's begin the session with the case 1. This is a case of panic attack. A 33-year-old male patient who was into home business. His presenting complaint was panic attack with uncontrolled fear since 2 years. He was on allopathic medication for 2 years, but by the time he came to me, he has left those medicines. His other complaint was complaint of back pain since long time, with a burning sensation which used to aggravate on exertion and lifting heavy objects. Past history, he had inguinal hernia both the sides at the age of 18 and right femur fracture 4 years back. He also had the dengue 5 years back. Personal history, hunger, he could not tolerate hunger, very foodie person, refused any kind of food. He's thirsty, thirst for cold water in all season, desires sweets and non-veg. Urine and motion were normal. Perspiration more non-offensive, non-staining. Sleep is normal on abdomen, no snoring. It's very difficult to wake up. Even after waking up, I feel very drowsy. Dreams of misfortune, negative dreams, dreams of snake, dreams of failure. Thermally he was towards sleep. Noise he cannot tolerate, hates music, irritates him. He used to come with his whole family comes to my clinic, and he was one of them. He used to come always with a follower. Even the phone ring, he used to get very, very irritated. He's that intolerant with sound. Traveling sickness, nausea was present. So let's move to our favorite part, that is mentals. I'll read out the exact what he explained it to me so that you'll get the better picture of what he's trying to explain. I have fear which is not under control. I become anxious easily. I cannot stay alone at home. I'm into business. I have my own hotel and bakery. I have a sweet manufacturing factory. Confusion is more since 1 year. When I am alone, there is no confusion. If there is one customer, I have no problem. I can deal with it. If more than one customer comes, I become very confused and I go into panic. I start shivering with full of confusion. I will get confused what he asked for and what I'm supposed to order and how much to charge him. I have less patience. I am very impatient person. Even for silly things, I can lose my patience. I have 3-year-old daughter. If she jumps on me suddenly, I will get very angry even on her. He is a very impatient man and confused person. I cannot tolerate if someone repeats the question or any sentence. I will throw whatever is there in my hands. I have damaged several phones because of this. I can go to the extent of hitting people if I'm angry. It has happened with workers as well as customers. Before I wasn't like this. These days my anger is not under control. I cannot withstand interruption from others. I get confused easily if someone interrupts me. Confusion along with anger. I can do only one thing at a time. I can't do more than one thing. I become nervous and start shivering if there is more than one work. I weep easily if someone tells anything, even it could be a silly thing. I have good confidence. Sometimes I have overconfidence in myself. He's basically an emotional person and he cannot withstand emotion. I have less friends. I don't share my feelings with anyone. I like being consoled by my close people. Staying alone is a difficult thing now. I never go home if nobody is there at home. These things started recently before I wasn't like this. My elder brother is little dull. He does not have much confidence. So I asked the nature difference between him and his brothers so that to know his nature better.
Hold your microphone near your mouth so that your voice will be audible properly.
It's raining, so that is it. Now is it fine, sir?
Not clear actually.
Sir?
Yeah, you can just follow it still.
Okay. My elder brother is little dull. He does not have much confidence. I take good decisions. I have more anger than him. I am more successful in life than him. I help him in everything. I was his financial supporter. I am more hardworking than him. I want neat and clean everywhere. I'm very particular about things. I keep things in a systematic way. I get food easily. I trust people in seconds. So he's a very fastidious person and very ambitious one. I got married 4 years back. I have 2 kids. Wife is a housemaker. We take decisions together. I'm good in planning things than her. I'm a very ambitious person. I wanted to grow fast in my life. I did not want it to be like my brother or father. My father was a farmer in native. I want to achieve things and achieve faster. I like branded things. I purchase only branded things because I like to show off and nobody must point at me for looking cheap. I make different goal sets for my wife so that everyone will appreciate how good I am in working and making money. Then he told me just about his childhood, that he was very sincere. He was not a mysterious one. His mother is a schizophrenic patient and he used to take care of his mother. Father was into farmer. He has seen lot of outbursts of his mother. He was bullied by other kids teasing about his mother. He used to not care much. Uh, now she is taking good care of his mother. I wasn't like this before. I was a very confident person. Now I get scared even to drive my car. I feel I might meet with an accident and die on spot. Who will take care of my family further? I cannot even cross the road alone. I feel something bad will happen to me. I always get negative thoughts when I do something. If my daughter comes home 5 minutes late, I get thoughts like she met with an accident or someone kidnapped her or something bad happened to her. I have extreme fear of death. I was trying to get ailments from, but there was nothing specific. Nothing happened 2 years back. Everything was good. I was making good progress in my business in 2 years. I don't know why this all started suddenly. At last, he told me something which is really interesting, which helped me to enter this case. Sometimes people notice that if I sit somewhere, I will be completely lost. I will not be there in this world only. I won't be thinking anything or imagining anything, but I will be completely blank. Someone has to come and shake me for more than 1 minute for me to wake up. My eyes will be open and I am lost. Many times my wife and others have noticed this, but nothing will be running in my mind. And it feels like I woke up from a long sleep, but it will be just 5 minutes blank. Others has to get me back. So this is the case. Is there any inputs from this history? What do you understand? What did you understand till now? Was I clear or was I too fast?
He gets angry very easily.
Yeah. Ambitious person, impatient, social position, concerned about right, abstraction of mind, right. Any other things?
Trans.
Thanks, yeah, very good. That is a entry point of my case. Do not tolerate contradictions.
Dreams of
So,
misfortune.
yeah, correct. So this is how in each case I divide the rubric so that it will be easy for me to pick up the points. Do not tolerate exclusive, fastidious, branded thesis. So in Surah, we see anxiety with fear, irritability music during, irritability questioned when, sensitive criticism. Psychosis, we see fear of misfortune, confusion, absorbed general, concentration difficult, anger interruption from, anger contradiction from, fear danger impending of, music aversion to, fear accident of, vanity and impulsive. In syphilis, we have trans. So trans is the entry point in this case. And my next rubric I took confusion because it was very prominent. So I just took two rubrics. One is trans and another is confusion, mental exertion from aggravation. Just these two rubrics I took. Antares, chamomilla and nuts mosquito was these three remedies by coming. What do you think the remedy is?
Chamomilla.
Yes, even I thought of Chandrila because he was very irritable person. Anybody has any other ideas? Cancerous is very quarrelsome and rebellious. But this patient was very drowsy person. When all follow-ups used to come in, other follow-ups, other family follow-ups used to come in, he was yawning, very drowsy person, so I selected this Mr. Pradhan. 201 dose. So the next follow-up was symptoms are better by 50% from panic attacks. Going to the blank episode has reduced, so that is the question which we should find in the follow-up. Fear has reduced but still present. Confusion is better by 30%. Anger and irritability is same. Confidence is getting better. Acting is little better now. Continue with fear. Feeling more better, no confusion now. He had fever once. I asked him to take medicine. I did not give him any medicine. He was feeling better. So I continued with the fear, no confusion in word, confidence was better. He was able to, you met, he was able to handle the customer more than one customer now. There was no confusion and drive alone freely. He developed few joint issues after going for jogging. I continued with the fear again because mentally he was doing very good. Gradually, the joint pain reduced by itself. He developed boils on chest, forearm, and arm, fungal infection in groin region. He continued with PL. Mentally, no, everything is fine. He's doing good. There is no panic attack now. So I did not repeat any Lux mosquito again. So let's see a few things about Lux mosquito. So ailments from anger, excitement, fear and grief, pregnancy, mental work, milk, suppressed eruption. In emotion sphere, we see fear, fear of death, heart disease, pregnancy, menses suppressed or scanty from. In anger, we see impatience and irritability, joy, cheerfulness, fancies, cheerful, it is only remedy, ecstasy, laughing, sardonic. We have a lot of things in intellect. Intellect is affected here. Absent-minded, absorbed general, concentration difficult, confusion, memory weakness, dullness, forgetfulness, ideas deficiency, mental exertion, aggravation, and thoughts vanishing. There is a weird thing about the time, that is delusion, time exaggeration of. Time passes too slowly, time passes and lost or confused. Mistake makes time. Now, let's see about the rubric trance. Trance is a hypnotized feeling which is achieved by meditation or drugs. It is a suspended sense with the absence of response to external stimuli. Sensory and motor activity is diminished or absent momentarily. There are three types of trance. Possession, which is by the extraordinary or supernatural power. Hypnotic trance is by the hypnosis. Religious trance we see in the temples like ISKCON. So this is how the joy moves from Sora to the Siddhi, that is the highest point. In Sora we see cheerfulness, mirth, hilarity and liveliness. Elevation mental is sorrow, psychotic. There is pride in elevation mental. Psychosis we see exultant, exuberance, exhilaration. Psychosyphilitic, there is vivacious and ecstasy. Highest is the syphilis, we see three rubrics: blissful, trance, and indifferent apathy, joy too. This is how joy moves from Sora to syphilis. Is there any doubts or any queries? I'll move to next case. This is case 2. 35-year-old female who owns her own beauty parlor. So she was diagnosed with hypothyroidism. TSH was 92.62. T4 is 1, T3 is 35. She was not on allopathic medication. She was referred by another patient. Increasing weight since 4 to 5 years for another company. Hair fall since 2 years, white discharge since long time. This was her report. This was on 21st July. Coming to personal history, she cannot tolerate hunger, prefers cold food. She's a thirsty patient. Perspiration more, non-offensive sweating. Sleep is normal. Thermally chilled, which is not required. Sensitivity-wise, she has sun aggravation, cannot tolerate noise, and clothes she cannot tolerate height around the neck. Menses were regular. So moving to the mind. So this lady, she was married at the age of 15. She wanted to study more, but her father was very dominating, and she was supposed to marry what the father has seen. She wanted to study, so she used to feel bad looking at the other people who were going to study further. So she got married at the age of 15. And again, in the in-laws' place, they are very dominating people. She used to do all the works at the age of 15. It was a joint family again, and she was the elder daughter-in-law there. So within 1 year of marriage, I have cut short this case. Her husband met with an accident within 1 year. Within 1 year after the marriage, that time she was 2 months pregnant. Because of the shock, she had the miscarriage. Again, she had this feeling that it was a bad luck. She was a bad luck in the family. She lost both the baby, and her husband. So after that, she was sent back to her house where they did not welcome her well. So one of her cousin called her to the Bangalore to help her in the parlor which she had got. So she came to Bangalore, and she was very good in mehendi designs. People used to hire her for the mehendi designs. She told me one thing, that she was just 20-year-old, but she looked like a 25-year-old girl. And she started mingling with people, talking with people gradually. She had this feeling of having a second marriage again. She had the thought. So she had relationship with 4 guys after the marriage, but none of them were ready to marry her. Each one, she believed them very blindly. After 30, she lost interest in marriage again. Now she tells me that she has reached a saturation point where she does not feel anything. She tells me that her emotions are dried up. Her mother expired 3 years back, and she could not even cry. She did not feel like crying also. She was like she is old and she died. And she's not attached to her friends also. These things started lately, that she's not attached to friends or anybody. And she also has this fear that she'll lose everything because of her bad fate. Especially with the family members, she don't like to get along. Her grandmother also passed away. She did not go for the funeral itself, and she was very close to her. Still, she did not go to the funeral. She's like she's old again, and she died. She has become more practical now. Again, she started telling me about her bad luck. She does not have a husband. Alone. So, is there any inputs from this case? I have got a lot of things here. Just the important paragraphs I have changed. Is there any inputs from this history? Reproaches self.
Delusion,
Yes.
unfortunate feeling.
Delusion, unfortunately, is correct. I did not go to delusion. Indifference, yes, correct. Indifference. So I took indifference, apathy, loved ones to an unfortunate feels. These were the remedy. I was thinking about carcinosin or sepia. The one question was running in my mind that why did she go for have a relationship with four other guys? The one thing which she told me is I'll read out her paragraph. I had relationship with so many people is because I wanted to have kids. Those days I was mad about kids. I love children. When I married, I wanted to have three kids. I used to hug kids even when I see them on the road, give food even to construction workers' kids. I even tried to adapt, but for single parent, nobody accepted. Once I got to know all these men took advantage from me, I lost having kids. So she lost interest now. So this rubric, no, it is affection, children craving for. In Kara, the only remedy is carcinosin. Since I have not seen the indifferent stage of carcinosin, I was thinking this case is sepia. So I gave her carcinosin. So TPO was negative. She told me that in 1 week, and even in the scan report, no nodular growth, no goiter, by discharge is present. No new complaints. I continued PL for 15 days. She developed right tonsil inflammation. Uh, my discharge is better by 50%. So after 1.5 months, she got the TSH again.
Yes,
to
come in.
48.29. T3 is 92, T4 is 3.6, PL4 1. This is her report. This is her report of September. I continued with PL for again another month. Her hair fall is little better. TSH is 12.8, T3 is 98, and T4 is 5. This is her report of November, 12.80. Hair fall is better, no new complaints. Again, I continue PL. She had slight fever on December 27th. I think it was eclipse. TSH was 7.45, T3 is 87, and T4 is 5.4, PL for 2 months. So this is her Jan report, 7.45. After 2 months of PL, the TSH came to normal 3.50, T3 is 71, and T4 is 6.56. In March she came and I continued with the PL, so this is her recent report, 3.50. This is how the TSH readings came down gradually every 2 months. I did not repeat and I did not increase the dosage. Only 1 dose of carcinosin. Is there any doubts? Any queries?
Is there any change in the weight of the patient?
Yeah, she reduced 2 kg, not more than that. From 76 to 74. So this is a little more apart from our carcinosin, what we have not thought about carcinosin. We also see these rubrics. Alcoholism, dipsomania, anger, violent and temper tantrums, audacity, clairvoyance, concentration impossible, confusion trifles about it's a single remedy rubric, cruelty, brutality, inhumanity, dancing desire for fetus of to music. This is a single remedy rubric again. Exactly don't know what is the meaning. I think there is an increased fetal movement when a lady is pregnant. Disruptiveness, disobedience, haughty, impatience, injustice cannot tolerate, irritability causeless, irritability children and violent against single remedy, kleptomania, rage fury, rudeness general, tears himself. There is also untidy, violence, vehemence, deeds of rage leading to. Shall we go to next case? Is there any questions or shall I move to next case? Okay, the case 3, again a 34-year-old female patient. This is a thyroid case again. So the presenting complaint here, the TSH is 147.49, T3 is 0.39, T4 is 0.90, TPO was not done, and she was not on any allopathic medication. Another complaint is weakness since 1 year, pain in right shoulder since 2 years, complaint of she had a migraine right-sided since 2 years, amelioration by vomiting. In the past, we see a right kidney stone 4 years back and a history of TB and pneumonia in childhood. Personal history, hunger is normal, cannot tolerate hunger, eats very slow, takes 2 hours to eat, thirst less, 1 glass after each meal, urine is normal but offensive smell, bowels are hard stool sometimes, has to strain, burning sensation after passing motion, perspiration more, offensive sweating, sleep is normal, sleep straight, grinding teeth or sleep, wakes up by slight sound, even doorknob turn can wake her up. Dreams vivid, past events, long forgotten events, keeps repeating in dreams. Past events which I don't like to remember, I see in my dreams. Sensitivity wise, she has sun aggravation, cannot tolerate noise. Menstrual history is normal, again, the flow is very offensive. Moving to mind. So she tells me that this is a second marriage. She was married 10 years back. 10 years back, they were together. In first marriage, it was for 2 years. First marriage was a very horrible marriage. The husband was alcoholic and he used to abuse her, hit her, burn her with cigarettes. So even the mother-in-law used to defend her son that because of her appearance, he is going to other ladies because she was a very thin lady. Even mother-in-law was very abusive to her. She used to threaten her to pour kerosene on her and burn her. She used to feel very angry, but she used to control a lot. The patient did not complain to family, not to police. She just went on suffering with them. Somewhere she had the hope that after one kid, everything will be normal. She did not wanted to. Main thing is that she did not wanted to spoil her family respect and the name she had. They had in the society. But things got worse once they had a very big fight, and mother-in-law locked her up in the room and made her starve for 3 days. This is when the neighbor called her family and told them what is going on. The family came and took her back to their house. She stayed alone at home uh, for 1 year. After that, after 1 year, she started working as same as accountant to support her family financially. So 6 years went like this, and after 6 years, one of her relatives came home with a proposal. He was a divorcee. He was 41-year old and had 15-year-old daughter. Initially she did not agree for the marriage, but later initially she did not agree for the marriage, but later she agreed because she got to know that he stays in Bangalore. Her main intention was to move out from the Malpe, that is near Mangalore, because her past thoughts were haunting her. So she agreed for the marriage just to move out from that place. Then she explains about the second husband. He's a very good natured and he used to respect her a lot. And slowly she started smiling again, mingling with people, and started making friends. So what happened after 6 months of marriage? There was a sudden loss in husband's business. So he has this thought of going back to native and starting fishing business there. She was against it, but she could not refuse a lot. Everyone suggested the same thing to come back. His house and the ex-husband house are very far, but it is in the same city. So she started regretting about her marriage now because her past events started haunting her. Now she tells me that I shouldn't have agreed for this marriage at all. I should have stayed single. Now I have no option. I felt why should I be alive to go to that place again? Because I felt there is no use going back to same old place and suffering. It is better to die instead. Then she explained about her childhood that she was a very shy and timid kid. She used to take tuition for the younger kids to help the family financially. She scored 81 percentage and she took commerce. Even now she is very shy and silent. She get angry, but everyone can make out from her face, but she does not express her anger. Relationship with family is good. Parents are supportive. Relationship with brothers are also good. Relationship with in-laws are good. She talks to her mother-in-law more than her mother. She treats her like her own daughter. Memory-wise, she is good. We're not very good in calculating. Others cannot take advantage from her easily. Before she used to trust, now she has got the trust issues. And she is also very sincere in her work. I like working. I was very sincere in my work. I cannot sleep without completing my work. I used to get worksheets, Excels, everything to home and work. This is her case. Can you suggest what do you get from this case? Reproach yourself, yes. I took the same rubric. Reproaches herself.
Desire to die.
Desire to die, yes. And so I just took these three rubrics. Death, desire, reproaches himself, and discharges offensive. I got Ophidia, I gave her Raja and PL for 1 month. Headache frequency has reduced, no vomiting, shoulder pain is better by 50%, weakness is same, thoughts about death is same, that has not reduced. Still, I continued PL for 1 month. EPO was not done. Next month, she comes with bleeding from anus while passing motion. No mass per rectum, frank bleeding along with the motion. Headache is much better, no vomiting. Weakness is same. Increased thoughts about death, loathing of life. Does not feel hungry. Eats only one meal in a day. EPO was 430.83. So this is a very bad follow-up. Bleeding from anus, not feeling hungry, increased thoughts of death, and TPO 430 is a very bad follow-up. So I did the retake again. I went back and again I asked her for 1.5 hours. So I just wrote the gist of what she had explained it to me. I'll read it out. My main question was why you do not want to go to Maldives? What do you feel? She said, my second husband parents are really good people, but I feel I will be tortured like before. I will not have my freedom. I will go back to my old life where they used to hit me, beat me, abuse me, insult me all the time. I feel I'll be going back to that time where I was in hell. But I know his parents treats me like their daughter. They are really good people. After marriage, they came with me to Bangalore and they are really good. But if I go to Maldives, I feel I will go back to my old tortured life. I don't know why I am feeling this. I don't want to go back there and suffer like before. Instead of going back there, it's better to die here. So from this paragraph, what can you make out? Delusion being tortured, yes. Dr. Manohar sir says. Any other things? Death desires, yes. Death desires was very prominent in her. Any other rubrics? Suicidal thoughts, yes. Delusion tormented, correct. Even I thought rubric like delusion, misfortune, inconsolable, or delusion, injury will receive. This delusion injured surrounding by. So I thought of all this, but again and again she went on the same thing that if I go back there, I'll be suffering like my past. Okay, she's somewhere confusing her past with her future. They are really far in the Malpe. Okay, but she's confusing that her past life she'll be going out there. But here the mother-in-law family, they are totally different people. Okay, it is more of confusion. Dwelling, yes, she's dwelling in her past. Any other rubrics can you think about? So I just took two rubrics, dead desires and mistakes makes time and confounds future with her past. She's mixing up the two things, that is future with her past. So I thought I just typed time and repertory and I searched for this rubric. Smooth and delusion, she is confusing her two things. And Stephysagria was the remedy. I gave her Stephysagria 10 one dose. And if you see Clark, in Clark mind last but one line, he says that Stephysagria has delusion about the past events. And again, Stephysagria is a very dignified remedy. After 1 month of the year, she developed a right inguinal region hernia. There was a very mild inguinal hernia, white discharge since 1 week, very thick like white egg, headache weekly twice, had vomiting, constipation since 15 days, no bleeding, the bleeding has reduced. Right shoulder pain is better by 50%, no fancy odor in sweat, urine and menses flow. I'm not thinking about dying now. Sometimes I get thoughts, but I feel something can be done. So there is a little of positiveness here. So I continued with PL 15 days. Inguinal hernia was same. Headache frequency has increased, had vomiting once. Shoulder pain is better by 60%. Constipation is little better. Continued with PL. Headache is better now. Weekly once, no vomiting. Constipation is better. Swelling in inguinal region is same, palpable. Shoulder pain is better. Weakness is better now. Her husband got a job in Bangalore itself. I asked her to do TPO after 3.5 months. And this is the TPO result, 29.4. Her TSH remained high still. From 147, it has moved to, I think, 123. TSH is 123, T3 is 0.45, T4 is 1.19. Irritation in urine while passing motion, slight burning sensation, lump in inguinal region is same, no pain as usual. Headache is better, constipation is better, shoulder pain is better by 50%, weakness is better, mentally, but now she's asking me if she can get pregnant. She couldn't get the TFT done. Recently, she got the TPO result again. I wanted to recheck this just yesterday. She sent me the report. It is 15.2. She could not get the TFT done. So the autoimmunity has reduced. The TSH will take time to reduce. So I'm just waiting. She developed inguinal hernia. Again, it is a psychosis less. So I take it as a good sign, and the death desires have reduced. So I take this as a good sign, and I'm waiting for the TSH to reduce. I'm not going to repeat the remedy or increase the dosage. I will wait for another 2 months. Is there any questions or inquiries? I'll move on to next case. So this is a 65-year-old male patient. It's a gallbladder stone case. Pain in abdomen since 15 days. Pain is severe along with the vomiting. Frequency is daily. Aggravation after eating. Has to take painkiller. Got into emergency casualty last week because of the pain. Scanning was done. This is the scanning report. Gastone 15 into 11 mm. There was renal calculi. It is small, 4 into 4 mm both the kidneys. Mild prostatomegaly. This was taken 1 week before coming to me. Personal history, he cannot tolerate hunger, very foodie, eats in bulk. Thirsty patient, desire for sweet, spicy, and meat. Thermally hot patient. Coming to mentals, I'm very dominating person. I always want my rules to run in the family. I have certain principles and everyone must follow that. I get angry when someone does not do that. So he's having a textile factory which his papa started. He and his two brothers are looking after it, and he's the head of the family as well as in the factory. So he used to control everything. So he's now 65, but after 60, his kids and his family members started. It is a joint family. His family members started telling him to give up his responsibility to son and his brother because he was having a lot of pressure and BP was fluctuating. Once it reached to 230 by 100 and he fainted in the work. After that, uh, his son and the second brother started taking the responsibility slowly. They started taking decisions without me. He did not like that. They asked me to stay home. I used to get very irritated and angry. It was my job. People used to respect me before. Since I started staying at home, I feel nobody is respecting me. Before, people used to do namaste to me on the road. Now they don't because I'm not the head now. People started taking me for granted. I feel I lost my power. I don't like it. Is there any inputs? I made it very short, that case. It's a lengthy case actually. forsaken, delusion, dictatorial. Yes, he's a very dictatorial, very dominating person. Self-esteem. Yes. So I was feeling there was something more than what what they were telling. So I asked, I spoke to brother separately. He told me the same thing, nothing more than this. I spoke to the son as well. Even he told me the same thing, that he likes power. So he cannot tolerate when someone takes his power. Nothing more than that. Then wife came like third empire, and she told me one thing which helped me. Wife told me that even though he was a very respected person, he has a bad habit of gossiping and putting down others. He won't leave our own son also. He will tell his brother that our son earns nothing and he is wasting life with his wife. To our son, he will speak about his brother and he is having affairs with a neighbor's lady. It's not only in the family, even with the friends, he does this. He lies and makes people believe it. He gossips a lot about everyone. So he has a bad habit of gossiping. So what is this rubric now? Wife. Gossiping and telling lies about others. What is this rubric? Any inputs? Slander. Yes, this is a slander disposition. So I just took 3 rubrics. In general, vigor, colic, gallstone, social position concerned about, and slander disposition. To support patients, so I gave him Lyco 200, 1 dose, and PL for 15 days. This report is not after 15 days. This is after 5 months. It's not overnight. So there is no evidence of gallbladder calculi. Even the renal calculi is absent. He developed spontaneously reducible bilateral inguinal hernia with omentum acid content. He did not tell me any symptom. It was found in the scan. I'm continuing with PL. I have not changed the remedy here. His pain in abdomen has also reduced. Is there any questions?
What do you think about that hernia? Will it go on its own, or have you consoled the patient?
No, it is a psychosis less, no? So from psychosis mode, it has case moved to the psychosis less. So I'll be waiting in this case.
No, what I'm asking is, have you consoled the patient about what is this?
Yeah, I have told him. It's fine because he did not notice it and he did not have any symptom. He did not even know. So I told him it's a good sign. I have explained him. And he's okay with that. He's taking still medicines.
Okay.
Delayed milestone walking, not able to stand without support, not started walking. Is 2.3. Recurrent cold and coryza, obstruction of nose at night, aggravation, air draft and fan. Complaint of not gaining weight since 1 year. Weight is 10.5 kg. Past history, he had imperforated anus at birth, got operated at the 8th month. Delivery was C-section, reason was cord around the neck. Milestone was neck holding at 5th, crawling 10th, sitting she does not remember, teething 18th, talking 24th, standing with support 24th, walking is a presenting complaint. Personal history, hunger, he cannot tolerate hunger, eats a lot, eats as much as parents do. appetite is increased, and thirst normal 1.5 liter per day, desire sweets and fruits, aversion to milk and milk products and egg, thermally chilly patient, noise gets scared, traveling sickness, vomiting in the bus and cab, urine normal, bedwetting is there sometimes, bowels hard, strains while passing motion, perspiration more, especially on scalp, sleep normal, holds his mother while in sleep. So moving to mentals, he likes to arrange his toys. He likes only the soft and stuffed toys. He does not like car, trucks, and cubes. He does not share all his toys with others. He takes his favorite toy to bed. He cries easily for all simple things. He cries even if we talk in little louder voice. He gets scared if we shout. He was not a cranky kid. He shows anger sometimes. If he will throw things in anger, not mobile and remote, things like devils and other soft things. He gets anger when we don't do what he wants. He's not a demanding kid. If I tell him tomorrow I will buy you, he will keep quiet. He will not throw tantrums outside. Very well behaved kid outside. We can divert him easily when he demands. Very sensitive kid. He does not get close to other kids easily. It takes time for him to mingle with his cousins and neighbors. He is not very comfortable with other kids. If I carry other kids, he does not have any problem. If elder cousins comes home first, he will crawl, hide inside the room. Slowly, he will come out after some time. He does not give high five or shake hands with the strangers. If someone is there in the terrace, he will keep quiet until they go away and start shouting as soon as they leave. He does not like loud music. He likes soft music. He tries holding pencils and sketching. He has fear of darkness. He will not go alone to dark room. He is scared of music. He will sometimes startle on sudden sound. He cannot stay alone. He will start crying. He keeps biting his nails. He sometimes mimics the cartoon characters. If he likes something, he will not get over it easily. He had one pink shawl every day. He gets it near him, and one day we lost it, and he cried for many days. He likes his grandparents. If they come home, he will not let them go back. They will hide from him and go. He has one cousin who is a little older than him. He hits him or punch him while playing. He does not like her. He will not react. He will cry and go to mother. So in this case, do you think the mother history is important or no? Should I take mother's history or no?
Because she had imperfect illness at the birth.
Yeah, imperforated illness. So we should take the mother's history. I took mother's history. So she told me I stayed in my in-laws place itself for a whole pregnancy. My sister was also pregnant at the same time, and she had come to her mother's place. Mother cannot do all the work, so I stayed here, and even hospital was near to in-laws place, so I stayed here. When I was fourth month pregnant, my brother-in-law got married, her husband's younger brother. New Bahu came to home. I was the eldest daughter-in-law. She is a good girl. Relationship with her was good, but my mother-in-law started acting weird gradually. That girl came from a rich family and she got a lot of dahej to the family, lot of gold, mixer, fan, washing machine, etc. So mother-in-law kept her on the top. She did not give her any work to do. Even though I was pregnant, she asked me to do the work and tell her that she is new and she will not know any work here. I could not get so many gifts because our family is not rich, but I always stayed as a good daughter-in-law till now. We did not have any fights till now. After the new girl came, she completely changed. She used to directly tell me that we did not see so many gifts in the first son's marriage. I used to feel bad. She used to tell me in front of everyone. I did not do anything wrong. I always stayed as a good daughter-in-law. Why are they comparing now? What can I do now? I used to get very angry. I did not react. I used to cry alone in bathroom. What she is doing is not fair with me. My husband was also not very supportive to me. He used to ask me to keep quiet and not tell her anything. So basically, she was very, very angry on her mother-in-law. So, what is the elements from here? What is the sensitivity here? Elements from domination, suppressed anger, rejected, suppressed anger, yes. Her anger was a rightful anger. Well, so I took ailments from indignation, work late. She was telling that I was a very good daughter-in-law. Okay, so that is why I took it as indignation. So she used to insult in front of everybody. Work late learning too, emaciation, general appetite, ravenous with. So there was two remedy, natrum mur and naxonica. What do you think the remedy is? Nux. What? Sorry. Natrum mur. Yes, natrum car. I give natrum car 200 pills for 1 month. So started with 5 minutes and there was severe itching in the ears. I continued with ear. The itching in the ear was so severe that they used to call me midnight and tell "Madam, ತುಂಬಾ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. This itching is too much." But his walking was better from 5 minutes to 10 to 15 minutes. So I continued with ear. Trying to walk without support walks for 5 minutes and fall. So every time I used to give him 1 month ear. In me, after 4 months, walking is better. Itching has reduced a little, not waking up at night now. No cold and caressa. Continue pills for 1 month. I have the video.